Trastuzumab, also known as Kanjinti 420 mg intravenous solution, is a medication used to treat certain types of breast, stomach, or esophagus cancer. It is specifically used to treat tumors that produce more than the normal amount of a certain substance called HER2 protein. Trastuzumab belongs to a class of medications known as monoclonal antibodies and works by slowing or stopping the growth of cancer cells. The recommended daily dosage and optimal timing for taking this medication should be determined by a healthcare professional based on individual medical needs. In order to receive Kanjinti 420 mg intravenous solution Antineoplast EGF receptor blocker Recomb monoclonal antibody, a healthcare professional will administer it through a slow injection into a vein. The frequency of administration is typically once a week or once every 3 weeks, with the first injection lasting at least 90 minutes. The dosage of this medication is determined based on your medical condition, response to treatment, weight, and other medications you may be taking. It's important to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. To maximize the benefits of this medication, it should be used regularly. You can mark the days on your calendar when you need to receive the medication to help you remember. In some cases, your doctor may also prescribe other medications, such as acetaminophen or diphenhydramine, for you to take before each dose to help prevent serious side effects. It's important to follow your doctor's directions carefully in this regard. Some common side effects of Kanjinti may include redness or irritation at the injection site, diarrhea, muscle or joint pain, stomach or abdominal pain, headache, trouble sleeping, nausea, vomiting, mouth sores, and loss of appetite. Nausea and vomiting can be severe, and your doctor may prescribe medication to help with these symptoms. Eating small meals and limiting activity may also help lessen these effects. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to seek medical attention if you experience symptoms of heart failure, bone pain, numbness or tingling, changes in mood or mental state, irregular heartbeat, easy bruising or bleeding, chest pain, weakness on one side of the body, trouble speaking, vision changes, confusion, or signs of infection such as a persistent sore throat, fever, chills, or cough. Trastuzumab, the active ingredient in Kanjinti, can also cause a rash, so be sure to contact your doctor if you develop any skin rashes. In rare cases, a severe allergic reaction may occur, so seek immediate medical help if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, contact your doctor or pharmacist. If you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Trastuzumab, also known as Kanjinti, is a medication used to treat certain types of cancer. However, it may cause serious heart problems, including heart failure. This risk may increase if you are also using an anthracycline, such as doxorubicin. Your doctor may stop treatment with this medication if heart problems occur. You may experience reactions with your injection, usually during or within 24 hours of the dose. Your healthcare professional will monitor you closely to decrease the risk. If you have symptoms such as fever, chills, flushing, headache, nausea/vomiting, trouble breathing, dizziness, weakness, or feeling faint, be sure to tell your healthcare professional right away. Your doctor may slow down or temporarily stop your injection to address these symptoms. It's important to note that trastuzumab can cause serious harm to an unborn baby if used during pregnancy, possibly leading to fatal consequences. It is crucial to discuss reliable forms of birth control with your doctor if you are considering taking this medication. Be sure to follow your doctor's guidance for the best time to take this medication and the recommended daily dosage. Before using Kanjinti 420 mg intravenous solution, make sure to tell your doctor or pharmacist if you have any allergies or if you have a history of infections, heart disease, lung problems, or previous cancer treatments. This medication may increase your risk of getting infections or worsen existing infections, so it's important to stay away from people who are sick. It's also important to let your healthcare professional know if you have any immunizations or vaccinations planned, and to use caution with sharp objects and avoid activities that may result in injury. This medication can cause dizziness, so avoid alcohol and marijuana. If you are pregnant or planning to become pregnant, talk to your doctor about reliable forms of birth control and the potential risks and benefits of using this medication. Lastly, consult your doctor before breastfeeding while using this medication and for 7 months after stopping treatment. Now, let's talk about the potential interactions of Kanjinti with other medications. It's important to note that combining certain drugs can change how they work and may increase the risk of serious side effects. This is why it's crucial to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's also important to never start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's worth mentioning that Kanjinti is very similar to other medications such as Trastuzumab deruxtecan, Trastuzumab emtansine, and Trastuzumab hyaluronidase. Therefore, it's important to avoid using these products while using Kanjinti to prevent any potential issues. As always, it's best to consult with your healthcare provider for personalized advice on the optimal timing and dosage of Kanjinti. If someone has taken too much Kanjinti and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Before starting to use Kanjinti 420 mg intravenous solution, it is important to undergo lab and/or medical tests such as heart exams and complete blood count. These tests should also be continued during the use of this medication. It is crucial to keep all medical and lab appointments to ensure the effectiveness and safety of the treatment. Remember, it's crucial to take each dose of Kanjinti 420 mg intravenous solution Antineoplast EGF receptor blocker Recomb monoclonal antibody as prescribed. If you happen to miss a dose, make sure to consult your doctor or pharmacist for a new dosing schedule. This medication works best when taken at the same time each day. This medication, Kanjinti 420 mg intravenous solution, is administered in a hospital or clinic setting and is not meant to be stored at home. It is used as an antineoplastic agent and is a recombinant monoclonal antibody that blocks the epidermal growth factor receptor, EGFR. This medication is used to treat certain types of cancer and should only be administered by a healthcare professional. The dosage and timing of administration will depend on the individual's specific condition and medical history, so it is important to follow the guidance of a healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.